Hello and welcome. I am Shelby Pfizer from Sorcery. This is a reflexology presentation I gave back in November of 2018. The presentation was for a Lunch and Learn segment at Beynon Sports in Cockeysville, Maryland. I am uploading this video for educational purposes. I hope that you enjoy it and that it expands your knowledge of reflexology. First, a bit of shameless self-promotion. Again, I am Shelby Pfizer, and I am a reflexologist and owner of Sorcery, a holistic and alternative health company. The word soul, of course, means the bottom of the foot. Sorcery refers to magic. Therefore, our tagline is Magic at Your Feet. We have an office in Cockeysville, Maryland, and provide mobile reflexology and Reiki services throughout the Baltimore metropolitan area. Let's begin with a little history lesson. Evidence of reflexology, or stimulation of the foot to balance the body energetically, dates back over 5,000 years ago in India. Later on, with the spread of Buddhism, monks are thought to have introduced reflexology to China as far back as 4000 BC. As an aside, by approximately 2500 BC, the Chinese had also divided the body into what are called meridians. These were essential in acupuncture and acupressure, and we'll see something similar related to reflexology later on in history. In Egypt, wall paintings depicting early signs of reflexology were found in tombs as early as 2500 BC. Following the fall of ancient Egypt, the practice of reflexology likely migrated slowly to Greece, Arabia, and then on to Europe through the Roman Empire. Fast forward to the early part of the 20th century. In the United States, the precursor to modern reflexology is credited to Dr. William Fitzgerald. He is known as the father of zone therapy. He found that if he applied pressure using tools to certain parts of the body, other areas of the body reacted. He started working on the toes and fingers of his patients and quickly realized that this relieved headaches, earaches, and other pain during minor surgeries. Based on this information, Dr. Fitzgerald divided the body into longitudinal zones. When working anywhere in a zone, the rest of the zone elsewhere in the body was also affected. This bears striking similarities to the Chinese meridians I mentioned earlier. Dr. Fitzgerald was not working alone, however. Dr. Edwin Bowers was originally investigating Dr. Fitzgerald's claims until he himself became a believer. He then encouraged Dr. Fitzgerald to publish his work. In 1915, Dr. Bowers wrote an article entitled, "To Stop That Toothache, Squeeze Your Toe." Later on, together, Dr. Fitzgerald and Dr. Bowers published a book called Zone Therapy in 1917. It contained therapeutic recommendations and guidelines for doctors, dentists, gynecologists, ear, nose, and throat specialists, and others. Another doctor influenced by Dr. Williams Fitzgerald was Dr. Joe Shelby Riley, who was actually trained by him as well. Dr. Riley was the first to make detailed charts of the reflex areas found on the feet, hands, and ears. He also eliminated the use of tools during reflexology and developed a manual hooking technique to apply pressure to the body. Dr. Riley also continued to develop zone therapy by adding horizontal divisions to the zones of the feet, hands, and body. His first book, Zone Therapy Simplified, was published in 1919. Dr. Riley had a physiotherapist working in his office by the name of Eunice Ingham. She is considered the mother of modern reflexology. Mrs. Ingham discovered that intermittent pressure, as opposed to constant pressure, stimulated a healing response in the body. She also drew detailed maps of the reflexes of the feet and hands, stating that the reflex points corresponded with the bodily organs and glands. Eunice Ingham published 2 books. The first was Stories the Feet Can Tell in 1938, and then Stories the Feet Have Told in 1951. She traveled across the United States for 30 years teaching reflexology. Therefore, most authors in the field of reflexology were trained by her. As reflexology in America was fairly new, Mrs. Ingham actually faced court proceedings for practicing medicine without a license. All of these charges were dropped, however. Now we're going to take a look at a few reflexology charts. This first one is nice because it has pictures of the body parts and what areas of the foot correspond to them. These areas are called reflex points. The brain reflex is located on the big toe and corresponds to focus, concentration, attention deficit hyperactivity disorder, and headaches. To address a toothache or earache, focus on the toes reflex. For heart problems, there is a reflex located right below the big toe. Regarding asthma, address the lung reflex, which is located in the middle of the foot. For digestive issues, stimulate the reflexes for the stomach, liver, and intestines. The spine reflex runs down the inside of the foot, starting where the nose is, down to the heel. So if you want to address back problems, you can start there. The upper back is higher on the foot, and the lower back is down at the bottom. The feet contain approximately 7,000 nerve endings. When reflexology is performed, it therefore stimulates the nervous system. Reflexology also stimulates the circulatory system, promoting the flow of blood throughout the body. Here is a hand reflexology chart. You can see how different areas of the hands correspond with areas of the body here as well. For example, take a look at the dark pink semicircles on the inside and outside of the wrists. These are the reproductive reflexes for the ovaries, testes, uterus, etc. Stimulating these points may be ideal for someone interested in increasing fertility. And next is an ear reflexology chart, which shows more reflex points. Having visual issues, the eye reflex, which is the blue circle towards the lower lobe of the ear, is where you will want to focus. The terms reflexology and massage, especially foot massage, are often used interchangeably, although reflexology is quite different. As a definition, massage involves the manipulation of the soft tissues of the body, which are muscles, connective tissue, tendons, and ligaments, through kneading, rubbing, stroking, and other techniques. Reflexology, on the other hand, as mentioned earlier, focuses on the stimulation of predefined locations, the reflex points. Right here, he's working on the mid-back. The key word to remember for massage is movement, while the key word to remember for reflexology is pressure. In addition, reflexology is a less invasive procedure, only requiring the removal of your shoes and socks. So, what do you need to become a reflexologist? When seeking a reflexologist, keep in mind that reflexology laws vary based upon location. Some states require reflexologists to be licensed massage therapists. Others necessitate separate licensing or registration, while some states do not regulate reflexology at all. Maryland as a state does not regulate reflexology, but individual counties and cities may require a license. You should also be aware of the type of reflexology education your practitioner received. Internet searches provide results for dozens of training programs, but each state may have specific requirements. Several schools in Maryland offer 200 and 300-hour reflexology programs. As a side note, some massage therapy schools cover reflexology as a part of their coursework. However, this is usually a general overview and not nearly as intensive as reflexology programs. Many reflexology professional organizations exist. An excellent place to begin your research is the American Reflexology Certification Board. The board, established in 1991, provides certification for reflexologists, information on reflexology education, and a list of board-certified reflexologists across the nation. The Reflexology Association of America is also a useful resource. The state of Maryland has the Maryland Reflexology Association to assist you. So now I've told you all about reflexology. What are its benefits? I want to point out that reflexology is not a cure. Instead, it encourages the body to repair itself. Reflexology is often used as a complementary therapy in conjunction with medical treatment, which means that it is used along with your doctor's care. You should always check with your doctor before receiving any type of additional treatment, be it traditional or alternative. However, reflexology has been found to be helpful for a variety of conditions. Physically, these conditions include type 2 diabetes, cancer, multiple sclerosis, high blood pressure, arthritis, fibromyalgia, and asthma. Other physical benefits include increased circulation, toxin elimination, digestive tract stimulation, pain relief, promotion of healing. This is especially helpful following surgery, and relaxation. Reflexology is not only good for the body, but also good for the mind. Some mental benefits of reflexology include reduced stress, increased energy levels, enhanced self-esteem and confidence, decreased anxiety and depression, enriched coping and communication skills, and improvement in mood. Reflexology is continuing to grow in popularity in the Western world. At one time, it was thought of as quackery. However, studies have proven its effectiveness. In Canada, reflexology is covered under health insurance policies. As America continues to embrace alternative therapies such as massage and acupuncture, which are also covered by some health plans here, we hope that reflexology follows suit. So, when is reflexology not to be used? I know that you probably didn't want to see pictures of serious foot issues, so here are some nice bacteria instead. You don't want to perform reflexology if there are any foot infections, including fungal issues such as athlete's foot. In addition, if there are any foot injuries, wounds, or open sores, you do not want to touch the feet at that particular time. Circulatory issues such as deep vein thrombosis are also a contraindication for reflexology. Remember that reflexology promotes circulation, so if someone has a blood clot, we do not want to take the risk that it moves and travels to the lungs. This is called a pulmonary embolism and can be life-threatening. Poor circulation can also cause edema, which is swelling. If the feet are particularly swollen, it is best to avoid reflexology until the situation is further resolved. Here is a picture of a fertilized egg. In the event of a high-risk pregnancy, reflexology is not recommended. Reflexology should also be avoided in the early stages of pregnancy as well. As with all things, if you are in doubt about whether you should receive reflexology, please consult your doctor. Now, you're convinced that you should give reflexology a try. What should you expect? At Soul Sorcery, before the session begins, we will ask you to complete a brief health history form so that we are aware of any issues you are experiencing and what you would like to have addressed during that visit. Reflexology can take place on a massage table, like the one here in my office, or on a reflexology chair. These are very comfortable. This is my chair, and her name is Henrietta. Ambiance and environment are very important, as your reflexologist should try to ensure that you are as relaxed as possible to receive the maximum benefit from your treatment. I normally don't keep the room this dark, but it was a pretty picture. Our goal is not to induce pain. If your feet are very painful and sensitive to the touch, then this may be indicative of the need to seek medical attention. Reflexology should not hurt and is both a serene and invigorating experience. However, you may feel some tenderness as pressure is applied to certain areas of the feet. We will frequently ask you about the amount of pressure we apply to ensure that you are comfortable during the session. We encourage you to be vocal as well. And so, this concludes my presentation, and thank you for attending. Feel free to contact me at soulsorcery.com and have a wonderful day.